The oral maxillofacial surgery program at Emory represents one of the more prestigious programs in the United States. Here at Emory, we offer both a 4-year certificate program and a 6-year certificate. The decision is, do I do just a 4-year certificate program where we'll teach the basic surgical skill set and you graduate with a certificate and you end up practicing on a dental license. The other choice you have is to become an integrated program, which is a 4-year certificate in addition to 2 years of medical school. So you actually graduate after 6 years here at Emory with an MD degree plus your certificate, and you now practice on a dental and medical license and still have your training in oral and maxillofacial surgery.
The training and the culture here was what ultimately brought me back. I got excellent training here when I did my residency here.
We have a lot of different centers of excellence. So we have Grady, where the residents get to participate in a lot of the trauma. Then we have Midtown and Emory, Maine, where some of the elective surgery happens. And then we have Children's Hospital. Our program here at Emory is one of the only programs in the country where residents get to participate in care of pediatric patients.
Part of the residency program here is being able to train in a level 1 trauma center, one of the busiest trauma centers in the country.
My experience at Grady has taught me a lot about how to be an effective provider. It has taught me a lot about communication with patients. It has made me feel comfortable in all different clinical settings.
One day I'll see and treat a patient with a big benign tumor of the jaw where they're going to require 12-hour surgery. The next day I might see a patient with a simple dental abscess that requires a tooth extraction that may be only a 10-15 minute procedure. And then another day someone comes in with a broken jaw and after a car accident that requires a 2-hour procedure.
I was very happy with my MD training here, as well as my general surgery here. As a resident, we get a wide exposure in terms of treatment planning, surgical experience, hands-on experience, and patient care experience. Another reason why this program really attracted me was the research opportunities it presents to its residents.
For those that are interested, the opportunity to do research is limitless here at Emory.
One of the main things I looked for in a residency program was somewhere where I was going to get exposed to as much as I possibly could be.
After I'm done here, I do feel like I would be comfortable going into whatever fellowship that I would choose or whatever practice scenario because of the breadth of instruction that we've gotten here.
To be completely honest, it's probably the best thing that could have happened to me from a professional standpoint to end up at a place like Emory.
Atlanta has been a lot of fun. There's a lot of young people here, there's a lot of young families, there is a lot to do.
The weather is beautiful, so you can spend a great deal of time outdoors. You can fly anywhere in the world so quickly from Atlanta, as I do twice a year flying back to Australia.
If you want to finish residency and feel like you are very well trained and prepared to go out into practice, whatever that may be, I can't think of a better place to train than a place like Emory.